Hi everyone, this is Tara Salzberg, the owner of Care Compass in Duncansville. I am a licensed insurance broker specializing in Medicare. And the Medicare annual enrollment period has begun. It runs every year from October 15th to December 7th. And this is your opportunity every year to take a look at your Medicare plan to see if you need to make any changes. So I wanted to specifically focus today on standalone prescription drug plans. This is a question that I get a lot, not just from my own clients, but from people who call needing assistance with this. So specifically, if you have a supplemental or a Medigap insurance, and as a friendly reminder, that would be if you have original Medicare as your primary and then you have a secondary insurance, that is Medigap, that is a Medicare supplement. Along with that type of medical coverage, you very likely have a standalone prescription drug plan. And so that's what I want to focus on today, is showing you how to check that prescription drug plan to make sure that it is still a fit for next year. So I want to note, if you have supplemental insurance, it is not actually affected by the open enrollment at all. You do not need to make any changes to your supplemental insurance. It will just continue on as it always has. However, your prescription drug plan may change from year to year, and also your prescriptions that you are taking may change from year to year. So it is always advisable to check your prescription plan to make sure that it is still a good fit. So before we go in and I show you how to take a look at that, I wanted to just make a couple of quick notes. Again, the annual enrollment period runs from October 15th to December 7th. So if you make any changes during the open enrollment period to your prescription drug plan, those changes will go into effect on January 1st. If you change your prescription drug plan and it goes into effect on January 1st, it will automatically cancel out the coverage that you had before. So if you enroll into a plan, you do not need to do anything with your previous prescription drug coverage. It will automatically cancel that coverage and the new coverage will go into effect on January 1st. Now, if you choose to stay on the same prescription drug plan, you do not need to do anything. That plan will just continue on into the next year. The other thing that I would like to note is that in 2025, there was a cap introduced at the pharmacy. It was $2,000. So if you were on some more expensive medications, there was a chance that you would meet that $2,000 cap. That cap does not take into account any premiums. It is only the amount that you could potentially pay at the pharmacy each year. That cap in 2026 is increasing slightly, and it will go up to $2,100. So if you're on low-cost generic medications, you probably will not get anywhere close to that cap. But if you are on some more expensive medications, just know that that cap has slightly increased to $2,100. Okay, so let's take a look at how you can evaluate your prescription drug coverage to see if it's still a good fit for next year. All right, we are on the official Medicare.gov website. And it should look something like this. It might look a little bit different. There might be a different person here or something like that, but generally speaking, it should look just like this, Medicare.gov. And this is a great tool that lets you take a look at different coverage options. So when we are talking about standalone prescription drug plans, there's actually two ways that we can go ahead and kind of explore those different options. So we can do that by actually just coming here, not logging in, and just looking at Find Plans Now. And I will kind of quickly show you that, but I do highly recommend here at the top, you can log in. You can actually create an account, a Medicare.gov account. And from that account, you can add in your prescriptions and they will be saved. You can add in your preferred pharmacies. There's also some other great information in there, what plan you are currently enrolled in. If you're not collecting Social Security and want to pay your premium, your Part B premium, you can do that by being logged in. So there's a lot of benefit to actually having a Medicare.gov account. And I will show you that in just a minute. But if you do not want to create an account, you can actually just come here and do Find Health and Drug Plans. And we are looking for coverage for next year, so that will be 2026. And we will just put in our zip code. And for sake of this video, we are looking at standalone prescription drug plan. So that will be the one here in the middle, Medicare Drug Plan Part D. We'll click on that, Find Plans. And this next step asks, do you have Medicaid? Do you have supplemental security income, Medicare savings program, extra help? If you have any of those, you would want to click on those, but I am going to click I don't get help from these programs and continue on following the prompts. Now, do you want to see your drug costs when you compare plans? Yes, that's a big part of what we want to do. We want to check our prescription plan. So we're going to do that by putting in some of our medications. So quickly, I'm just going to put in lisinopril, really popular medication. And I'm going to use this drop down to choose the dose that I want to put in. So I'm actually just going to keep it at 10 milligrams, one a day. So I'm going to leave that at 30 a month. You can adjust this to 90, perhaps every 3 months if you want to. Whatever your particular prescription is, that is what you would use. And then go ahead and add your drug to your list. If you have another drug, you would just click add another drug and add that drug onto your list. Once you have completed all of your medications, you can click done adding drugs. That will then take us to our preferred pharmacies. So I always like to add on a mail order option just to get a comparison. And then we can also search up here in the pharmacy name section to find a particular pharmacy. We can also just scroll down to find pharmacies that are in our local area, and you would just click on that particular pharmacy if you'd like to add it to your list. So I am going to add, I'm just going to do Martin's as my preferred. Let's see if that pops up here. So I'm going to do Martin's there, and then let's put in Walmart as well. I always recommend putting in at least 2 pharmacies. So pick a secondary pharmacy if you'd like, and put that in there as well, just to give you all of your options. And then you will continue to view plans. And that is where we're going to actually look at all of our plan options for 2026. So again, that is if you do not actually have a login with Medicare.gov. But as I mentioned, I highly recommend actually having a login with Medicare.gov. So let's hop over and kind of access what it would look like from being in a Medicare.gov account. Essentially, we are going to end up in the same spot. We're going to end up looking at plans. But here, I am actually logged in to a Medicare.gov account. And you can see all of these different things I can do. Find health and drug plans, request a new Medicare card, check providers. It also shows what plan I am currently enrolled in, okay? It also shows if there's a plan deductible, or excuse me, a Part B deductible, then I would have that here, and it would show how much of that deductible I've met for the year. So lots of different information right at your fingertips. And if I click on Open All Options, that's really where we want to go, because my goal here is that we want to check prescription drug plans. So we want to add in our medications and our pharmacies, and what that will do is that will actually save that information in our Medicare.gov account. So each year we could actually log in and all of that information would be saved for us, and we can just update it. So it is a time saver. So we want to come up here to Open All Options. We want to put in our pharmacies and our medications. So first thing I'm going to do is click on Update My Saved Pharmacies. And you'll see here actually that I already have a few pharmacies listed. So I have a mail order option, a CVS pharmacy, I have Martin's listed. I could add another pharmacy by just clicking this button here, adding on a particular pharmacy. I could remove a pharmacy if I want to. I'm going to go ahead and just leave those sort of as they are. Click OK. And then I'm going to head back into Open All Options. And now I want to actually put in my medications. So I'm going to update my saved medications. And we'll see here there's one that I already have listed in there. So I could potentially remove this. Maybe I'm no longer on Mounjaro. I could leave it on there. I'm going to remove it for now. And then I am actually going to kind of start from scratch here. So I could add an individual drug by clicking this Add a Drug button. I can also actually look at, and this is the power again of having a login, having an account, is that I can actually add recently filled drugs. So any of these medications that I've recently filled at a pharmacy, it will automatically pull them and populate them for me, and then I can just click on them and add them to my list. So that's a pretty cool feature. So I could do that and then just click back to my saved drugs, and you will see that all of these automatically save for me with the proper milligrams, how often I'm filling that particular prescription. So this is a pretty neat thing here that you can do. And then again, if I need to make any adjustments, I could potentially remove a medication. Okay. I could edit. So I could take this one and edit, and maybe I am now doing 10 milligrams of that particular medication, and my quantity and frequency has remained the same, so I'll just update that. Okay, and maybe here, we're going to take this one. This is a really good example. This is really important. You'll notice on the levothyroxine, there's a ton of different dosage options, and you'll see that there's capsules. You'll see that there are tablet options as well. And very, very often, the tablet will be much, much less expensive than a capsule, and very, very often, people are on the tablet and not the capsule. So just be careful with that. When you're putting in your medications, you want to make sure that you're being as accurate as possible. So I am going to make sure that I put in my updated 75 tablet there. And then again, I can keep the quantity as is, or I could adjust that if necessary. And then I'm going to update that medication. And then once I have all of my medications listed in here, okay, we can click Done Adding Drugs. Or if we're ready, we can actually begin our search for prescription drug coverage. So if I click Start a New Plan Search, so I am going to click Find Plans Now. And we are looking for plans for 2026. Zip code is 16635. And then the type of plan that we want, this will look familiar because we looked at this when we were not logged in. We are looking for drug plans. So you'll start to notice this will look exactly the same as what we already did. And then we get to our different plan options. And so what we can look at here is we want to check that our plans are sorted by the lowest drug and premium cost. And what that will do is that will give us the most cost-effective plan for our individual medications for the 2026 year. So it looks like WellCare Value Script populates here as the most cost-effective plan. We can see the monthly premium is $8.20. Now this next one is actually total drug and premium cost for 2026. So just keep that in mind when you see this number here. It is saying at a preferred retail pharmacy, the total cost for your drugs as well as your premium all together is going to be this number. So that does take into account your premium. Now if we go into plan details, we can get some more information about this particular plan. And up here at the top, again, we see our premium. We see actually at a preferred retail pharmacy, you'll notice this says 0. I'm actually not going to pay for any of these medications. At a mail order pharmacy, I'm not going to pay for any of these medications either. And we'll take a look at why that is. So again, it lists our total monthly premium. It does have a drug deductible on this plan of $615. Drug deductibles are going to be for medications that are higher cost, generally higher tiered. So that drug deductible is going to only really be for tier 3 medications and above. So based on what I'm looking at with regard to the price, I know that all of these medications I've put in are very low cost and they are not going to be subject to that deductible. But if you do have some higher cost medications, maybe you're on Mounjaro or Ozempic or Eliquis, some of those things that are tiered higher, then you may be subject to that $615 drug deductible. So if we keep scrolling down, we can actually see our drug coverage. This is exactly how I put that information into the system. It also has listed next my pharmacies that I have put in, and you'll see with this particular plan, they are all preferred pharmacies. And typically you do want to look at preferred pharmacies as your cost at a preferred pharmacy will be lower. Now that's not always the case. Sometimes you will see a pharmacy that is, quote, in-network or standard, and depending on the medications, the cost is actually very close to a preferred pharmacy. But especially when you're getting to some more expensive medications, usually you do want to look at a preferred pharmacy for the best cost. Now you'll see at all of these pharmacies, all of my medications are 100% covered. So I actually will not owe anything for any of these medications. Now you'll see a total drug and premium cost for the year is actually going to be the same. This is essentially just going to be my premium because my medications themselves are not going to cost me anything. So really this $98.40 is a reflection of just what my premium will be for the entire year. Now, if we come down and we click on this view more drug coverage, I actually a lot of times will start here looking at the particular medications, because what we'll see when we scroll down is all of the medications that we've listed in the system. It then tells us what tier they are listed on. So you'll see these are all tier ones. Tier ones are going to be very low cost generic medications. And if I scroll up just a little higher, I can see here, although these are not labeled, these are the tiers. So preferred generic is a tier 1. Your generic is going to be a tier 2. Preferred brand will be a 3. Non-preferred would be 4. Specialty would be 5. And then select care would be 6. So all of my tier 1 medications are a $0 copayment. So that's why we're seeing that when we go to a pharmacy, we're not paying anything for those particular medications because they are all tier 1 medications. Now, if we add some tier 2 medications mixed in there, then you'll see we have a $3 copayment. And that would be what we would pay at the pharmacy. Now, if we had a tier 3 medication mixed in here, that would, remember, be subject to that $615 deductible. So that might look a little different. We would have to meet the deductible first, and then tier 3 is a 25% coinsurance. So once we meet that deductible, each time we pick up that medication, we would be paying 25% of the cost of that medication up to the $2,100 cap that we chatted about earlier. So this is a really easy example here because all of these medications are very low cost tier 1 medications. And one other thing that we can do is we can look at our pharmacies and actually see what our costs are. So here at CVS, you'll see before the deductible, it's all going to be $0. And that's because, again, these are tier 1 medications, so they're not subject to the deductible. After the deductible, they continue to be 0, and they're basically $0 the entire way through the year for us. So let's say that that was what our medications look like, and this is the plan that seems to be the best fit. Generally speaking, it's going to be the plan that's coming up here at the top because that plan is going to be the most cost effective because of the way that we have it filtered by the lowest drug and premium cost. So if this is our best plan, if we are already on this plan, if we are enrolled in this plan already, there is no need to change. You do not need to do anything. This will just roll into next year. But if we're not on this plan and we wish to enroll in this plan, then we're going to click this button here that says enroll. And from there, we'll follow the prompts, and that will get us enrolled into this plan for January 1st. And again, if I do that, that will actually cancel out the drug coverage that I have currently. Now, let's take a look. That was, a pretty straightforward example, very low cost medications. I do want to show you what it can look like if we put in some more expensive medications, though. So I'm actually going to go back to my drug list here. And I am going to edit this by clicking View Edit Drug List. I'm actually going to remove a few of these medications. And I'm going to add in, let's say, Brio. I'm going to add in Brio. Oops. There we go. And you'll see it pre-populates it for me. And I'm going to then click Brio, and I'm going to add that. Now, this is something that, that can be a helpful tool. Brio does come in a generic version. So if you wanted to put the generic version, you would put Add Generic. If you want to keep that brand, then you would put Keep Brand. Now, I actually am going to keep the Brio brand. And we'll do 50/25. And I have, let's say, one of those every month. And so now Brio has been added to my list. And let's also add in, let's add another drug. Let's put in Synthroid. Okay, because this is another example of one that has a generic. So when I go to add this generic in, you'll see it does have levothyroxine. And actually, I think that might already be on my list. But anyway, there is a generic version of that. So in that case, I would, if I wanted to add the generic, I would just click add generic. If I wanted to keep the brand, some people do need to have brand Synthroid, you would keep the brand. So I'll add that generic on. And so now I've updated my list, and we'll click done. We'll click done adding drugs. Go down to the bottom. And again, everything is stored for us. And now let's take a look at what those plan options look like. So coverage year is 2026, zip code is 16635, and we are looking for standalone Part D plans. And we do not need to add in our pharmacies or anything like that because it's already there for us. Now we will see here what's coming up as being the most cost-effective option is this plan here. And it has a $19.40 premium. And then this number, $16.57, this is our total drug and premium costs for all of 2026. So remember, this is taking into account this $19.40 premium per month. And then it's also taking into account all of the costs of our medications on this particular plan. So if we pull up the plan details and want to look a little bit closer, we'll notice here that at a preferred retail pharmacy, it's going to cost us for the year for our medications alone, $1,424. And if we did go the mail order route, we could save a little bit of money with mail order. And if we scroll down, we see here our $19.40 premium. Now this drug deductible is a little bit lower than the one that we saw there. It's $601. And our medication, our Brio, I know that Brio is going to be a higher tiered medication. It is a brand name, more expensive medication that will be subject to this $601 deductible. And if we keep scrolling down, this is just my drug list exactly as I put it in. And if we keep scrolling down, we will see CVS, pharmacy, and Martin's are both in network, although they are not preferred. And then our mail order option is preferred. And then what you'll see is if we keep scrolling down here, our costs by pharmacy for the year. Okay. And our total drug cost at CVS would be $14.38. Martin's would be $14.24. So we do save a good amount if we wanted to go with mail order in this particular case. Okay. And again, this is our drug and premium costs for the entire year. So this will include both the cost at the pharmacy, but also that premium that we're paying for this particular medication as well. Now, this is our estimated total monthly drug cost. And so you'll see at the pharmacies here in the beginning of the year, we're going to have to meet that deductible. We are subject to the deductible. So we need to meet that first. And then after that, we are actually paying a percentage of this medication, and that's where we need to finish meeting the deductible, and then we're actually going to pay a percentage of this medication. And we'll scroll down and look at that a little bit deeper in a second. The rest of the year here, we're paying $86 at CVS, and the rest of the year here, we're paying, it looks like, $84 to $78, depending on the month. So if we scroll down and we look at more drug coverage, we'll see here these are our tiers. Remember, preferred generic is 1, generic is 2, preferred brand 3, 4, 5, and so on. And we'll see the majority of our meds are tier 1s. Tier 1s, again, are $0. We won't pay for them at a preferred pharmacy, and so that's great. But we do have this Brio, and now we'll see Brio is a tier 3 medication. It is subject to the I believe it was $601 deductible. And again, it's a tier 3. So if we come up here and we look at the tiers, a tier 3 is a 20% coinsurance. So after we meet that deductible, we are then paying 20% of the cost of that particular medication. So that kind of gives a good idea. And then we can go scroll back up to our drug costs by pharmacy if we want to look a little bit deeper at the particular pharmacy costs. We can do that. Now, once I've taken a look at this plan, again, usually what's going to happen here is the plan that's going to make the most sense for you is going to be the plan that is that's at the top here because of how we have this filtered by drug and premium cost. So again, if this is the plan that I am enrolled in, I don't need to do anything. But if I want to enroll in this plan for next year, I would click Enroll. And then from there, it would prompt me through the application with, in this case, Humana, and then I would enroll in that plan for January 1st, and the plan that I am currently enrolled in would be canceled out. I am here if you have any questions. I know this can feel overwhelming, but this is just sort of a guide. If you need assistance, of course, I am here to assist you. So please reach out. My number is 814-369-0708, and I would be happy to help further. Hope this helped. Have a great day.